And having this experience has opened me up to being able to help other women um, who have had a lot of complications. So I've had two women now in my life since then who've grappled with termination because they also got poor diagnosis. One chose to terminate and the other chose to continue with the pregnancy. Um, and having this perspective and empathy is so helpful because I also know that the decision I made for me isn't the right decision for everybody. And I think that we all just need information and then the space and the love to make that choice for ourselves.
Our TFMR stories. I'm Sabrina, the TFMR pregnancy loss doula, and today we have Rebecca with us. She tells her story of terminating her very wanted pregnancy for a T21 diagnosis, a Down syndrome diagnosis. So here's her story.
So my name is Rebecca and I live in Massachusetts. And the pregnancy that we terminated was my third pregnancy in about 2 years. So I had a lot of pregnancies back to back. And to understand how I felt for the termination pregnancy, I kind of need to back up to my first pregnancy.
Yeah, sure. Start
Um,
wherever you want.
yeah. So my husband and I knew that we wanted to try for children as soon as we got married. We had been together for 4 years when we got married, so we were pretty ready. I also was 35, so I was feeling that kind of push to, if you want kids, go ahead and try. It turns out we get pregnant very easily, so that was a blessing. But then my first pregnancy, I did miscarry at 5 weeks.
Oh, I'm so
And
sorry.
thank you. I do work. So at the time, I had a massage and yoga practice, and I specialized in prenatal and postpartum massage and prenatal yoga, which I still teach. So I'm so entrenched in the world of working with women who are pregnant.
Wow.
So when I got pregnant, I was like, this is it. And I started reading birth stories immediately and, just really trying to dig into having this pregnancy and what an amazing time it was going to be. So when I started bleeding at 5 weeks, it was really heartbreaking. Even though, we hadn't known that I was pregnant for that long, it felt like a really big deal. And then to go in and have them not even see a sac, just nothing. It completely invalidated how I felt about my pregnancy. So it was really hard. And then we were lucky enough to get pregnant again 2 cycles later. So again, we get pregnant really fast. So then I had a great pregnancy with my living child, Violet, and it went well, but I always had fears because we had had a loss to begin with. But then I felt like having such a healthy pregnancy with her and a really wonderful birth with her that, I was empowered and invigorated, and I was back on that horse of nothing can go wrong. So when she was 8 months, we decided to start trying again. And, we always expect it will take a while because even though the first ones didn't, we still expected it would. And then no, it was again a month. So I had my IUD pulled and then 1 month later, pregnant again. And because of how poorly the first pregnancy went, I became one of those people who takes tests constantly because I wanted to see that line getting darker and darker, you know? So I was testing and the line was getting darker and I was feeling really good about it. And then we went in, oh, let's see. Yeah, I mean, everything was going well. And then we went in for blood work because I was pushing that I wanted to have the Panorama done before, like, so that we had the results when I had the NT scan. And we had a viability scan and we saw that, baby had a heartbeat and everything. So I was all excited and I thought this is a really healthy pregnancy. I started having dreams immediately that it was a boy. And so the doctors didn't want to do the Panorama early. They had done it with Violet, no problem, but they didn't want to. And I pushed. And so they did it. I want to say it was 9 or 10 weeks. It was as soon as I could get it done and have the results be fairly accurate. And it was a much faster process because with Violet, it took 10 days to get those results back. And for me, it was less than a week. And they called with the results while I was sitting at work. And they told me first off that it was a boy, which again, I felt like I knew. And then they told me that he had a really high chance of having Down syndrome, T21. And I just started crying. And I was at my desk at work with my boss, who's a friend of mine, thankfully, sitting right next to me, and I just lost it. And I ran to my car so I could finish the conversation, and it was just, you know, a barrage of bad news, of things to process. We didn't know for sure it was T21, but it came back as being one of the highest indicators that it was. And so I was immediately scheduled for, I was going to have the nuchal scan done by maternal fetal medicine at the hospital that I was going to. And they wanted to transfer me to a place where they could actually do more genetic testing. So they gave me the option to do it's the CVS, right? The kind of, I never remember what CVS stands for. But
yeah, so that's the one where they take a Chronis villai sample.
It's the
something
villai
like
sampling.
that.
Yeah.
So they take a sample of your placenta.
Exactly. So they said, you know, if you know that you want that test done, then we need to send you to a different hospital to have that done. And I knew, I mean, I'm the type of person that I want all of the information. So I want all the tests. I want all of that. So I was sent to Beth Israel in downtown Boston, which is kind of a hike for me. It's kind of a long drive. And of course, they only schedule these things during rush hour. So I'm in rush hour with my husband in the car, and I'm a nervous wreck. And we had discussed everything with a geneticist ahead of time, because once the Panorama came back the way it did, we were referred to a geneticist in the same hospital.
Yeah. So
the nice thing
it got real fast.
It got real fast. Yeah. And I'll say the nice thing was that it was the geneticist who called me with my results. They had already made that transfer. And then she was the one who walked me through the whole process. So when I got to Beth Israel, she was the one I saw. She wasn't the doctor, but she, you know, helped facilitate me going into the room and communicating with the doctor. And then she met with me afterwards. So it was really nice that they had, you know, one person. But man, it is so hard to go to a room with women who are so pregnant and expecting and feeling really positive, and I'm there looking just as pregnant as them and knowing that things might not go well. Because of course, third pregnancy, I popped it at 8 weeks, so I was showing already. So I want to say, so this was 12 weeks. So we went in and we saw him moving around, and we could see his facial features at that point. And I could tell he had my husband's nose. And we had all those feelings of like, you know, we're seeing our child up on the screen, and we're just as excited as ever, even though we know this pregnancy might not work out. But I still felt like I wanted to bond to him. And then the doctor did say that the actual measurement of the nuchal ligament wasn't that thick. I mean, it was thicker than with Violet, but it was technically right below the line where there would be concern. So if I hadn't had the Panorama, we probably just would have continued the pregnancy. So they then made sure that I wanted the CVS and performed that, and I had kind of prepared. I was told that it can be really uncomfortable to the point of maybe being painful, and I do with Violet, I had done hypnobabies as a birthing program, so that teaches relaxation and self-hypnosis for pain management, and I actually used that during the CVS, and I didn't feel anything. So I'll say that the procedure itself went really well. The nurse actually said she'd never seen someone so calm. So, you know, that was nice, I guess. And then it was a waiting game again. So we knew that we would get the FISH results within 2 days. So that's the rapid test, but then it would take the full 7 to 10 days for the full results. And we also knew that I was getting near the end of my first trimester. So to have the type of abortion that I would choose, I wanted to try to do that in the first trimester because I was hoping to avoid having to be dilated and deal with the laminaria being put in, which I can explain more if you need. I don't know if people watching this would understand that or not.
Yeah, that's fine. You can just explain, the procedure that you ended up going through.
Yeah, so
And
I had,
because I'm gonna have, lots of different stories here on the channel.
yeah.
So yeah.
Um, so I did feel like I was in a bit of a rush because if I waited for the full 10 days to get the full results, I would have been 14 weeks and all of the places I had called nearby would have to do the abortion with the laminaria. So it'd be a
Oh,
2-day procedure instead of a 1-day procedure. So I ended up, yeah, we got the FISH results and they were positive for T21. And of
oh.
course, we're told, you can still wait. But we knew at that point that it probably wasn't mosaic, which was going to be the best outcome if there was one. If it had been mosaic, we may have waited until a little bit longer to see if anything else came. And it was, I'm stating all this factually, but it wasn't an easy decision. It was really hard in a lot of ways because before we started trying, my husband and I had a talk about, what would we do if these different scenarios came up. My husband, very black and white. If it's T21, we terminate. And I expressed very early on, before we even started trying to have kids, I don't know if I would make that same decision. You scroll through social media, you go online, you see a lot of really positive stories about very, happy families living with Down syndrome. It is not a death sentence. But then talking to a geneticist, you get a very different picture. So I suddenly had to become an expert in 2 weeks of what would my life look like if I do choose to have a child with Down syndrome. I already had a daughter who would have been, I think, 17 months when my son would have been born. And so that's an age where I really want to give her a lot of my attention too. So that's hard when you have a high needs child as well. I knew my husband was dead set on terminating. So then it's putting a lot of strain on a marriage, knowing that I might be choosing to end a marriage to have a child who has Down syndrome. And then I started looking at the actual statistics, and they're not great. A lot of kids who have Down syndrome go through multiple surgeries starting at birth. There are a lot of issues with heart, with all sorts of different organ issues. I mean, it's not just that they're delayed. And I was told, oh, well, life expectancy has gotten better. At the most, they might live to 60. And it's like, well, then that's not even necessarily a full long life. So I have all these things that I want for my child, knowing that I would be bringing a child into the world that would be suffering from day one and would possibly be going through surgery after surgery and then might die at an early age. It was a really heartbreaking choice, but I did come to the conclusion that it was the most loving choice for me and my family to say, I don't want to put you through this pain and let you go. So we did go ahead and book the procedure, and that was a whole process too, because I initially wanted my husband to be in the room, which a lot of places won't do. And I initially also wanted to do it drug-free. I was very fortunate to have a friend who is an abortion doula, and she helped guide me through a lot of this. So a lot of people don't know about abortion doulas, but they are amazing. She was just someone who has a wealth of knowledge about abortion. So whether it was an abortion, wanted abortion, an abortion because of a situation like mine where there was a medical necessity, She just was able to give me so much information and then guide me around. I mean, I'm so lucky to be in the Boston area because I had choices. I didn't have to travel, but I still had to do a lot of calling around and figuring out what policies different places had. I did end up choosing a place that didn't let my husband in the room, but would have allowed me to do it drug-free. But I also ended up making the choice after doing the research to do general anesthesia, and I'm glad that I did. The more I looked into it, the more it sounded like I was just martyring myself by saying I want to experience the pain. And the place that I chose, I also chose because they've been doing this for decades and they're very well established. Because my hospital offered to do it, but even at I think I was 13 and a half weeks when I had it done, they wanted to do the 2-day procedure with the laminaria, and they said that I was going to have to be in the hospital for 8 hours. Whereas the clinic that I ended up going to had me in and out in an hour. And they had everything that I needed. They had people to hold my hands. They had the experience. One thing I was really pleasantly surprised by is when I went, they had all of the information from my doctor with the T21 diagnosis, and they asked if I was willing to give some blood to be part of a research study, which I did, and it was to help make these tests that we do in that first trimester more accurate. So I was really grateful that I at least got to kind of give something back in that regard.
Yeah.
But it was rough. And then the other thing that was a hard factor is that I wanted to get his ashes back. So that was something that was important to me.
Mm-hmm.
And that's an unusual question, I guess, when you go to an abortion clinic.
Yeah.
So I did have to call funeral homes ahead of time and kind of arrange that and make sure that that was all set up ahead of time. And it's hard, it's hard doing all of these kind of high level things while you're also dealing with the grief of losing your child, and also the not fun times of being in the first trimester. I was still pregnant. I still had all of those symptoms. And, heartbreaking thing, but 2 days before was the first time I felt him move. And I've tried to walk those two worlds of really still feeling this pregnancy and trying to honor the fact that he is still there and still alive and still so wanted. I didn't want to just pretend that that wasn't happening. But I also really needed to gear up for the fact that he wasn't going to be with me much longer.
Yeah, it's like holding all of those emotions all together.
Yeah, it's really heartbreaking.
Yeah. And like you said, dealing with the grieving, but then also having to do all of this logistical planning. And oh, sorry, there are people here in the background.
I get it. Yeah, it was a lot. After the procedure, so it went really well. But then afterwards, I did have some really intense cramping. They had given me Pitocin, which I hadn't had before. When I had my daughter, she was a home birth, so I just didn't have experience with that. So I was just surprised that about an hour later, I was having these like really intense cramps. And I did have some complications, unfortunately. I didn't think I was trying to overdo it. I thought I was being chill, but about a week later, out of the blue, I started bleeding. And it was such an embarrassing story because I had gone to get my nails done. And I got up from the chair from getting a pedicure, and I had bled all over the chair. I had bled through my pants, I was wearing a pad, through everything. And I got home and I was horrified with the amount of clots that were coming out. I wasn't technically hemorrhaging, but it was a lot. It was a lot. And I ended up having to go, I had to go back in, and that was very triggering for me. Because, you know, I thought this was a thing that I'm now able to start working past. And then 1 week later, I'm back in the same place, in the same room, with the same doctors. And also because, you know, they're a well-known center in the area, they have their actual operating rooms in the basement because they've had people attack them before. So I'm also just like, you know, down in this basement, like I'm doing this covert thing that I'm not supposed to do, which is such crap. And they did see clots in the ultrasound, but I think, first off, they weren't that bad. My bleeding had slowed by the time I went in because they had me wait a day before I came in, since I wasn't really hemorrhaging. And I think the doctor just saw the amount of fear in me, and she said, you know, I think it's fine for us to wait on this, because the other choice was to do another D&C. And I was not mentally prepared to go under again and to have that experience again. So thankfully it all cleared up on its own, but it was not the experience that I wanted 1 week later. And then it was a lot of working on healing. I discovered ending a wanted pregnancy before I went through with the termination, because I knew I was going to need support. And so thankfully I had that resource on day one. So I had people that I could talk to who had the same experience as me. And that group was a savior for me. It was the only thing that I found online that really was the people who had the experience that I had. And I am pro-choice, but it is a different experience when you go in there with a pregnancy that's unwanted versus a pregnancy that you tried so hard for.
Yeah, it's definitely, it's just different. It's a very different experience.
Yeah, and I'm also, you know, I'm so stubborn and I've got to stick to a plan so much. So it was like, okay, well, we want a second kid, so we immediately need to start trying again. So I waited. I don't think we even really waited. The doctor had said because the procedure was done in the first trimester that we just needed to wait for the first cycle. And my midwife even said, and that's not because you have to for medical reasons, it just really helps us in dating the pregnancy. Okay. So 5 weeks later, I was pregnant again, because it took just a couple weeks for my period to come back.
Oh, that's so
So
fast.
it was so fast. It was so
Wow.
fast. And in retrospect, I do not recommend that for anyone. It was too fast. I was still dealing with all my emotions from the previous pregnancy, and I physically hadn't healed enough. I thought I had, but I hadn't. So with my daughter's pregnancy with Violet, I was super active through the whole thing. I mean, I was rock climbing until I was 37 weeks. And we had minor complications with her. I had an SCH in the first trimester, so I did have a little bit of bleeding, but I was never put on any sort of rest. So I was like so fit with her. And then the postpartum recovery was so easy with her because I was so fit to begin with. The pregnancy that I had after the termination ended up being my son, Wolfie. And I had an SCH in the beginning, and it was bad enough that they had me go on pelvic rest. So with pelvic rest, you're not on bed rest, you can still be up and moving around, but they say like, don't really exercise that much or keep it really light. So I was still doing light exercise. That resolved, I started working out again. Second trimester came, I started bleeding again. Went in, found that I had a low-lying placenta. And so again, it was pelvic rest.
Again, so this was for a different complication.
Exactly. So then I was on pelvic rest for about 3 months because it just took that long for the bleeding to resolve. And then the placenta did move up. So I didn't really end up with previa, but I had lost so much fitness that by then, it was hard to gain back, because when you're in your third trimester, that's not when you want to be going gung ho with your workouts. So I found myself in the third trimester trying to get my fitness back up again. And he was a big boy. He is 10 pounds, and I was showing really early. So it was just hard physically. It was really hard. We had an awesome birth. I was just ready to birth that boy. It was a little tough at the end because I was in prodromal labor for 2 weeks before I had him. So yeah, you were too.
That happened to me too. Yeah.
I actually remember, I
Yeah.
think we were chatting about that.
Yes. Yes. Yeah. And
Yeah, but the prodromal labor was
um,
such a pain in the butt, because it's like, oh, I'm gonna have the baby today. Nope. Nope. We just had a lot of contractions and now I just get to hang out.
yeah. Yeah. It felt like I don't know, for me, I felt like some of these complications maybe came up because of the stress of having a pregnancy after a loss. Did you
Right.
feel like that at all for yourself?
I did wonder. I mean, on the healing side, I just felt like I didn't give my body enough time to heal, so I blamed myself for what could have happened in any pregnancy. I mean, anyone could have an SCH, anyone could get partial previa. So I don't know that it's because I got pregnant so quickly that I had those complications, but I mentally gave myself a really hard time about it. So I beat myself up for that. And then the postpartum period, I had a much harder time healing, and I'm still 17 months out having some issues. So I beat myself up about that too. Um, the emotional stuff, what got better as the pregnancy went on. I mean, I constantly had a fear of losing him. I didn't believe I was going to have him until he was in my arms. And even then, I definitely had fears that I was going to lose him to SIDS or something in the first few weeks. But between the support groups online and then speaking with a therapist, I did get a chance to work through a lot during the pregnancy, which helped. But just the physical part of 4 pregnancies in 3 years and being 38, it was a lot. It was a lot on my body. Every time I see people posing the question of, I really want to try again, I really want to try again, is a problem if I try right away? Like, I was in the same boat. And if anyone told me to wait, which they did, then I would say, nope, 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 not going to wait. But I wish I waited a little bit more. I mean, I love that my kids are so close. They're 22 months apart, and that's great. But yeah, I wish I had just waited a little bit more to heal. Even just if I had gotten myself in better shape before the pregnancy.
Yeah. Can I ask you, like what was grieving like after your first little boy after you lost him to the termination?
Yeah.
Sort of, and then it was also on top of your pregnancy. But tell us about how that grief was for you.
I had I had a lot of trouble with how alone I felt with all of it. Um, there's a member of that ending wanted pregnancy group that always says husbands grieve differently. And for me, that was definitely the case. My husband wanted to just move on. For him, it was like this thing that we could forget about. It happened. It was horrible. We could just put that away, and we could just move on. And I knew that that wasn't how I work. And I knew that he wasn't in a place to be able to receive my grief. So that was really hard because he's my best friend. We've been together 8 years, and to not be able to go to him was really tough. And I tried. We had talks about it, and it was like he would just shut down. So, thankfully, I had the groups that helped. And I do practice yoga and meditation, and so that helped. But I also felt that family moved on too. It was like everyone moved on except for me. People at work knew what happened, or some of them did, but they would just tiptoe around it because no one really wants to ask. And I wish they would ask. I wish they would have said, how are you doing? And they didn't. I waited longer to tell people at work that I was pregnant with the new pregnancy. So where there was this like weird first trimester of I'm the only one at work who knows. And trying to be happy about a new pregnancy while still grieving an old pregnancy, it's impossible. It's impossible. I tried to be aware of what was happening so that I could still bond with my new son, but I knew that I wasn't as bonded with him as I was when I was pregnant with my daughter. I was just waiting for that other shoe to drop. And then family, it was interesting with my dad and his wife. When I called to tell them that I was pregnant with the new pregnancy, they were almost upset. Like they knew we wanted more kids, but I think I know they were surprised that we tried as quickly as we did. So then they had all these fears that it wasn't going to work out. And I could hear that in their voice when they're trying to congratulate me, but also my dad's really worried. And so that was really tough to take on. What's actually kind of nice now that there's been space and I've had time to figure out how I relate to the termination, I'm more comfortable talking about it now. And I don't care if other people are comfortable about it or not. So, because to me, I mean, he was still my child. I've had 4 children. 2 of them are alive. So to me, I'll honor that. I have his ashes. I ended up making it into a necklace mixed with breast milk from my daughter, and had a woman in Maine make a beautiful little tree of life wire wrapping for it. So that's one thing that I did while I was still pregnant with Wolfie to help me. And then I could wear that and have my son with me. And I still do wear that. And I also have the rest of his ashes with a little angel statue in our house. So I have that as a reminder. And I got a tattoo. That was the other thing. Between the pregnancies and that short 5-week time, I went to New York by myself. I did a little weekend trip by myself, and it was so healing and wonderful. I took the train from Boston. I love taking trains. And I'm originally from New York, so it felt like going home to see the city and go to some of the spots that I liked to go to. And I got a sweet little tattoo of a mother nursing her baby. And then I got 2 different stars for the 2 losses that I had. And now my daughter's 3, and she asks me about the tattoo. And I tell her very, flatly that, the 2 stars are for babies that didn't get to come to Earth. And she understands that. She's asked a lot of questions and she understands it now. So she knows that she has 2 other siblings that she didn't get to meet. So I like that. I like that through her there's validation, and that I'm comfortable sharing that story with my kids. Even though my husband, I can see him clam up every time we talk about it. That's, on him. I can still honor the fact that I've had 4 kids.
Yeah, that's really beautiful that you can share that with her, and that she's asking questions, and that it's for you and her, it's open.
Yeah. Yeah, it's nice. And having this experience has opened me up to being able to help other women who have had a lot of complications. So I've had 2 women now in my life since then who've grappled with termination because they also got poor diagnosis. One chose to terminate and the other chose to continue with the pregnancy. And having this perspective and empathy is so helpful, because I also know that the decision I made for me isn't the right decision for everybody. And I think that we all just need information and then the space and the love to make that choice for ourselves.
Yeah, just to know all of our options, and that
Mm-hmm.
any decision you make is valid.
Right.
Yeah. So they came to you because you are open with your story. Is that how that happened?
So one came to me because I was open with my story, and then the other I had she posted about stuff going on and complications, and she's a friend, so I just reached out privately to say, hey, if you need any help, you can talk. And that kind of opened up the floodgates.
Yeah, especially with, I don't know, pregnancy complications and baby loss. It's like, don't talk about it, right? So when there's someone who comes to you and says, tell me about it.
I know.
Finally, someone she could talk to.
And loss is so common, whether it's, miscarriage or termination. There's so many different ways that women lose babies. I wish that we would talk about it more. And being in mom groups of all types, it is rare for me to find moms who haven't had a miscarriage or some sort of loss. And because I'm open about my story, I will sometimes say casually in conversation of like, oh yeah, I had 4 pregnancies in 3 years, and oh, it was like so hard. And then people know that I only have 2 kids, so they feel really bad. And then it's this whole thing of like, oh, I'm sorry. I'm like, oh no, I didn't say it for that. It's just, this is a factual part of my life. Yeah, people
Yeah.
really don't know how to handle grief in our society.
No, no, we don't really know how to respond.
No.
Yeah, so your termination was what year, what date?
It was April 20th of 2018.
Okay. So 2 years and a few months now.
Yep.
Well, what do you think has been the most helpful for you with your grief, like your continued grief journey? How do you continue to work with your grief?
The support groups online are definitely the biggest thing. Knowing that there's a group of people that I can turn to who have a shared experience, that's huge. I just feel so connected in that way. And I feel connected to those 2 groups more than I feel connected to any of my other online groups. And more connected than some of my in-person relationships too, having that shared experience. And then the other thing is I just try to practice mindfulness. So I try to notice if my emotions or if my thought process is a certain way because of my experience with the termination or because of the grief. So I'll take that step back to see, okay, am I viewing this situation through this lens because of my grief? Is this subjective or objective? And I'll meditate on it and just kind of try to figure that out. So I think that those 2 things help me the most.
Is that a technique that you learned from your therapist, or is it a combination of your own practices and what you learned in therapy?
It would be kind of a culmination of the process that I've been doing with meditation since I was a child. I had insomnia and pain issues as a child, and saw a psychologist at a young age when I was in 2nd grade that taught me self-hypnosis. And so that kind of set me off on that path. And then I started practicing yoga when I was 15. And now I teach yoga and meditation. And so it's really just, it's not like a set program that I was handed. It really is just what a steady practice in meditation has taught me. And especially after, so I actually didn't mention this, but this is certainly related. After I had Wolfie, I had postpartum depression, which is not something I experienced with Violet. And I 100% think that that's tied into the fact that I had his pregnancy back to back with the termination. And the way that PPD presented for me is that I was having intrusive thoughts about hurting myself. I had no logical reason for those thoughts. Life was going really well. I had the support that I needed. I mean, having a newborn who never sleeps is tough on every mother. And I definitely do not handle myself well when I have a lack of sleep. But this went beyond that. This went to, I have a screaming baby in my lap and a toddler running around. And what if I just walk out into traffic right now? So it would just be these like little daydreams of that. And it wasn't like that I wanted that, but because I was thinking that, I was thinking this just isn't right. And I did start with therapy, but ended up doing a low dose of medication, which was just what I needed. It was like my wires were not working the way they needed to work, and meds did exactly what they needed to do. Because I really felt like I was going through another sort of puberty in a way where my hormones were crazy and my emotions were all over the place. And this leveled me out. And then a few months later, I was able to start tapering off, which was a whole other process because getting off of the meds, my body did not handle that well. But yeah, but
Wow.
now
Yeah, that's
everything's balanced out.
wow. Yeah, it's just so much to go through in like 2, 3 years.
Yeah. Yeah, it was a lot. It was a lot.
It kind of makes
So
sense
in,
though, like after everything that you went through, it's like the body had this reaction.
yeah.
Yeah.
Yeah, and now 17 months later, there are a couple of things that still haven't reboot. I'm still having hip pain that I used to have only when I was pregnant. I
Mm.
was told it was because I apparently produce a lot of relaxin when I get pregnant, that hormone that makes our
Oh.
ligaments stretch. Um, but I don't know why things didn't go back to normal after the last birth. And, bouncing around from doctor to doctor hasn't helped. And I also, since this January, so 7 months now, I bleed more days than I don't. And no one seems to be able to figure that one out either.
Mm.
So that is pain in the butt.
Yeah. Yeah, just
Okay.
just a lot to go through, and then the body is reacting.
Mhm.
Yeah.
Yeah.
Well, I'll ask one more question. What would you say to somebody who has just gone through termination for medical reasons? What advice would you give them?
I would say, as much as you can, give yourself grace, be kind to yourself. Everything you're feeling is justifiable, no matter how you feel. If you're okay with it 1 minute, and if you're in tears another minute, um, and make sure that you get support. So whatever that means to you, family support didn't work for me. Maybe it does for other people. For me, having a therapist to talk to, having a group of women in the same situation to talk to, that was the best thing for me. Also, exercise for me is a helpful thing that helps me stay grounded. So yeah, I would say build up your support structure as much as possible and allow yourself as much time as you need, because none of this, it's not a straight line. It's all a spiral. It'll all come back whenever it comes back. And the first year, the anniversary of my termination. Oh, it wasn't the termination. The termination I knew. It was the anniversary of the due date. So it was that October. I had forgotten what the due date was. I don't pay a lot of attention to due dates because they're all guesses anyway. My body knew. Somewhere in my subconscious it knew, because that day came and I felt like I was hit by a bus, and I didn't figure it out until late in the afternoon when I actually looked up my charts. And I was like, oh, October 27th. Here we are. Here we are. So yeah, just give yourself that permission to feel what you feel. And it does get better, but the best advice that I was given with grief is the pain of grief never goes away. You just learn to build everything else around it. And that certainly has been my experience. I will always love that child. I will always grieve that child, but it's not a thought that I have 24 hours a day anymore. it's just part of, who I am, but I can live with that pain now.
Thank you so much, Rebecca, for sharing that.
Thank you for doing this. I appreciate it.
Is there anything else you want to add?
I don't think so.
Okay.
I think that feels complete.
Okay. Well, then we'll be in touch then. Thank you so
Great.
much.
Thanks so much, Sabrina.
Yeah, thank you.
Bye.
Okay.
Thank you again so much, Rebecca, for sharing your story with us. And I'd love to hear from you. I'd love to hear your story. Would you like to share your story of TFMR? My contact info will be in the description box below. I would love to hear from you. And if you feel like you would rather process your story in a more private way, I also have free journaling prompts that you can pick up, journaling prompts for pregnancy loss. And that will also be in the description box below. Make sure to subscribe. I release stories weekly. See you next week.